Watch this video, and then I'm gonna pull up some statistics, and then we're gonna talk.
I'm here to remind you that stress and anger is the leading cause of autoimmune diseases in Black women. It was a lot to say, but I'm here to tell you that you need to take a break. If you can't fix it, let it go. And if you're angry about it, deal with it. Because stress is killing us. That whole strong Black woman thing, it was made to it's a setup, basically. So stop it. Ask for help. Detach, let go, whatever you got to do. But we out here dying of autoimmune diseases because we are trying to carry the weight of the world and help everyone but ourselves. So as a Black woman that has been dealing with stress her entire life, it seems, let go and let God.
Now what you have behind me is an article from the Society of Women's Health Research that we will be diving into shortly. But as a woman with an autoimmune disease that literally left me paralyzed from the chest down for about 3 months, 4 months, and then I had to take the rest of the year to learn how to walk, drive, poop independently. I have a whole video detailing how we got there. It's been a couple of years. I'm doing great now, but that's right up there. This is a real epidemic. This is a thing that is affecting so many more of us, not just the ones who, like Black women that have autoimmune diseases, but I didn't know that I had the possibility of an autoimmune disease just kind of lurking around in my system. But you know what put the key in and opened the door to this chaos? An obscene amount of stress. And I mean, obscene amount of stress that I was carrying, I was trying to manage on my own while thinking, oh yeah, I can do this. Not realizing that I was falling squarely into the idea of the strong Black woman stereotype, and it almost killed me. So let's look at some of the stats as to what this actually looks like, so we could talk about how we can actually, ways that we can on the day-to-day remove stress from our lives to keep us literally alive. Also, for those of you who are new here, hi, my name is Shayna. I'm a journalist. I talk a lot about decentering men and child-free living on here, and then I talk about other stuff when it comes to like my typey articles journalism job. So if any of that sounds like a vibe, please like, share, and subscribe. I'm also working on a series of things that I will be posting in the description when they are live. So keep an eye out for that. I also live in Barcelona, so I do a lot of travel stuff. Anyway, let's talk about this article as I put on my seeing glasses. Here we go, fantastic. So this is an article from earlier this year, elevating the impacts of autoimmune disease and Black women's health. Now, I'm not gonna read all of this, but I'm gonna highlight a couple of points. All the way at the top, approximately 50 million Americans have one or more autoimmune disease, with 4 out of 5 of those patients being women. So in general, as we all know, in relation to gender, women are the oppressed group. We're gonna carry more stress. When you look at that, how it intersects with race, and then how it intersects with disability, and like they're intersectionally, at the surface level, yes, women. You get more intersectionally, it affects marginalized women more and more and more. We're gonna dive into that a little bit more. So for example, women between the ages of 15 and 45 and 44 years old make up approximately 90% of lupus patients. So these are the kinds of stats with how much women are being affected more so than men as it relates to autoimmune diseases. And for those of you who need a simplified definition of what an autoimmune disease is, it's when your body attacks your body. It could be your, like for me, anyway, let me use I statements. For me, my B and T cells, I think it's my B cells, I can't remember, but some of the white blood cells that are meant to protect my body because of the amount of stress that triggered this for me, it attacks my optic nerve and my spine, which is why I lost the ability to move. So keep this specific autoimmune disease in mind, which is a rare autoimmune condition in which the communication between nerves and muscles are destroyed, weakening weakness of the skeletal muscles, also called MG. Keep that in mind as we talk about this. I have scrolled down significantly. In a 2018 study, race and ethnicity were identified as independent risk factors for a population with autoimmune hepatitis in San Francisco, California. In addition, research shows that African American patients make up approximately 39% of lupus patient cases, with Hispanic patients following at 14% of cases. Another study at University of Alabama, Birmingham, oh my gosh, Birmingham, found that MG occurred earlier and more frequently in African American female patients compared to white patients. We're skipping down a lot and we're continuing reading. We're going to start right around, I'd like to say, here. For example, African American women are 3 times more likely to develop lupus than white women and often experience more severe symptoms and complications. One study shows an increased frequency in racial discrimination was associated with greater lupus activity and organ damage. MG presents its own set of challenges. Beyond MG's impact on daily life, some studies have shown women experience higher rates of admission to acute care centers, and non-Hispanic Black women have a 37% greater risk of experiencing an emergency department visit for MG compared to non-Hispanic Caucasian patients. A lack of access to quality care, including limited or no insurance coverage or exorbitant cost of care, are also cases how Black women may experience certain kinds of socioeconomic factors with higher rates, that kind of, and it continues. Now, as women in the world in general, but especially as Black women, we recognize that there is a lot of stressors that we do not have control over. We do not have control over what the police are going to do, especially in the United States. We do not have control over racism. We do not have control over misogynoir. We do not have control over so much chaos that we are forced to be subjected to on a day-to-day basis. But there are little things that we can do in our day-to-day lives to help alleviate the weight that is on our metaphorical and literal backs sometimes, so that way we can decrease the amount of stress and cortisol in our system, so hopefully we do not enter, well, I'm already, speaking from somebody that's already in the throes of this. If this ain't you, I'm hoping that this video is gonna help to keep this not you. One, and I think that this goes without saying if you've been on this channel long enough, if that man ain't adding anything to your life, please let him go. You literally do not need the stress. Literally do not need the stress. And especially when it comes to the kind of care that a lot of Black women get, like medical care. We talk about medical racism all the time, right? If you don't have to experience more of the I was gonna say criminal justice system, but I mean for Black women it kind of is that, right? When it comes to the healthcare system, if you don't have to put yourself in harm's way, then just don't. So, and if that man is raising your blood pressure, and we say that haha a lot of times, but no, literally, if that man is raising your blood pressure, let him go. Don't take years off your life for a man. 2, I am also working on this personally, but finding constructive ways to get out our big feelings, especially anger, will help to not just like make us healthier, because it will get us moving and stuff, moving and communicating, but it'll also help to like expel a lot of that energy that we feel like, okay, it's not safe in other spaces. We have to keep it bottled up. We have to have everything in control. We have to let it out, because it's gonna come out at some point. For me, weightlifting. Weightlifting helps me to get so much out of my body. For my best friend, it's CrossFit. For somebody else, it's boxing. For somebody else, they join a run club. My niece could never, but listen, it works for my mom. Like, there's so many other ways that we can start to get some of these things out so that it does not try to kill us. And also allowing people to save themselves. I know that, especially if you're an oldest daughter, there's a lot of rescuing that you've had to do and a lot of organizing, family-wise, friend, whatever, that we have to do. Allow people the space to save themselves as you do your best to try and save yourself. Is that a pimple? No, it's not. Okay, got scared for a second. Off the top of my head, off the top of the dome, those are 3 things. But if there's more that you feel like needs to be added to this conversation, please type them in the comment section. That is all for now, and I'm excited to hear your thoughts on this. All right, talk to you later. Bye-bye.